Starting first with Dr. Jackson. Dr. Jackson is a pediatrician. He has served in many leadership positions in both environmental health and infectious disease with the California Health Department. For 9 years, he was director of the CDC's National Center for Environmental Health in Atlanta and received the Presidential Distinguished Service Award. In October 2011, he was elected to the Institute of Medicine in the National Academies of Sciences. Please join me in welcoming Dr. Jackson.
Thank you so much. Well, this is fun, and it's such a pleasure to be with colleagues and friends. Every student that's ever been in a class with me knows that this is going to be on every single exam that they take, which is, what's the purpose of public health? Is it to make you change your lifestyle? Is it to make you get your immunizations? And is it to compel people, or is it this one? And it is an extremely empowering definition, is to assure the conditions where people can be. And that means you have to measure, and we'll talk about that. You have to change, create a change. You have to measure that again, and you have to enforce. And we've got environmental health leader here from Los Angeles thinking about these issues. This is very liberating. It looks boring, but boy, oh boy, it really matters. So a few years ago, Howie Frumkin said, Dick, you have to read this terrific book by Whittle Rubinsky, who, and he said, this is the story of Frederick Law Olmsted. And Olmsted, you know Olmsted. He designed, his sons designed them. He designed Central Park, Prospect Park, all the parks in the east, the northeast, Seattle, Atlanta, etc. He also, his sons designed the LA River and how that would be done in a beautiful, healthful way back in 1920. It didn't happen for political and depression reasons. But he was also because it's a jewel on the face of the earth. You say, wait a minute, that was 1865 that he was in California, but it eventually turned into, of course, Yosemite National Park. He was behind it 50 years before TR got up on the top of Glacier Point with John Muir to actually put the parks in place. He had no data, but he understood that people need green spaces, people need fresh air, they need activity, they need socialization. He understood that the environment was linked to people's happiness and well-being. He was such a good organizer that Abraham Lincoln made him the head of the Sanitary Commission during the Civil War, which sounds kind of boring, but both the Union and the Confederate armies lost twice as many soldiers to disease as they did to combat wounds. So just really fixing up the hospitals. Again, he had no science, but he knew that if you were sick or shot, you needed to be in a clean place with clean water, clean food, clean bandages, and some reasonable level of glare, sunlight, and the rest. Well, I was really struck by how intuitive all of his work was. I had worked for about 15 years in California, and Lauren Zeiss was one of my close colleagues. You'll meet her later today, and she's the head of the Office of Environmental Health Hazard Assessment. But in 1994, I was invited to CDC to be the head of the National Center for Environmental Health, a job Howie also held. And it really was astonishing. I mean, I had no idea that, well, I knew we had a lead program, I knew we had epidemiology, I knew we had cancer outbreaks, I knew we had a laboratory. I didn't know we oversaw all the cruise ships and the destruction of the chemical weapons of the United States government, and I began to worry about climate change and body burdens of chemicals, some of which were endocrine disrupting. They were so endocrine disrupting, they're actually changing the gender of birds and fish in the Arctic. 95% phenotypic females. I mean, they look like females, even though it was half and half male female, because of the chemicals in the environment. Every day in my center, I would be taught about something that was really very frightening. And it was kind of a recipe for depression in some ways. There was another recipe for depression, which is we were living in North Atlanta. Our kids were in 3 different schools. My wife had a very hard job at Kaiser Permanente, and we were endlessly driving one place after another to sort of manage our lives. And every single day, I'm not making this up, I saw a wreck on one of the Atlanta freeways. And so, and every week on Tuesdays, we would go to the director's office. Dr. Satcher, David Satcher was the director when I first arrived, and we would have a meeting, and it would be sort of a half hour of technical scientific content presentations to all the directors of CDC. There are about a dozen centers. And I remember going to one of them, and one of them was on how we need to change medical care. And a similar slide to this was shown, how life expectancy gets better the more money you spend on medical care, with one big exception: the country over to the right. So we, as Brendan said, my oldest son is here, when he was in Costa Rica, he said in Costa Rica they spend 7 times less per capita on medical care as we do in the United States, and they live just as long, because they spend a lot on prevention and immunization and other such issues. And over again, this importance of prevention and really constructing environments that assure where people can be healthy as best you can was really what I was learning over and over again. And this was out of my wheelhouse, if you will. It wasn't right there. I remember being in that room, and I was on the airplane every week going to Washington, D.C., and I remember realizing that Americans are getting bigger and bigger and bigger, and it was harder and harder to sit on the airplane. I think they were making the seats smaller, too. But so the first time I saw these slides about the obesity rates in '95 and the change to 2000, and of course, if obesity goes up, you're going to see diabetes going up. Here is diabetes in 1995. CDC does all the profiling of this. I won't go into the details. And here it is by 2003. So this acceleration of the obesity epidemic, the diabetes epidemic, was on our radar screen, and people kept scratching their head. We don't know what's causing this. I mean, it was astonishing that somebody in 1999 wouldn't know what was causing it. But it seemed to me that if you don't exercise, you eat the wrong food, if you're saturated with advertising for stuff that's unhealthy for you, you have chemicals that are obesogenic in your diet, it was pretty easy to figure out what was going on. I'll show you the slides, the more recent slides at the end. So I'm thinking about the obesity epidemic, the cost of medical care, and by the way, think of those costs of medical care, and suddenly you have half the children who have diabetes in the United States having type 2 diabetes. I'm a pediatrician. I remember going to the children's diabetes clinic and never seeing a child with type 2 diabetes. We called it adult onset. Now if you walk into the clinic, and this is from the New England Journal of Medicine, you walk into the clinic now and half of our kids that have diabetes have type 2 adult onset diabetes. It's basically exercise and nutrition and induced and other causes, but those are the big ones. And this is a recipe for at least a 7-year reduction in your lifespan and at least a substantial increase in the cost of your medical care over your lifespan. This is a more recent study, but it captures also what's going on. This is a comparison over the last 20 years, if you will, of age-matched, demographic-matched people in the United States using NHANES data. What do you think happened to excellent health? We spent all this money on medical care, up. It was 12%, 17%, 18%. Look at that. Excellent health, after all this money, has gone from 32% to 13%. And people tell you they're healthy. They're usually pretty right. You have limitations to your life functions, that's gone up. Do you need a wheelchair or a cane? These people aren't that old. They're 46 to 64, 7% of the population, 1 in 14. You know these two. You know that smoking went down. You know obesity went up. But I was stunned by this next slide, this next report. No regular physical activity. We physicians have been wagging our fingers at people for 30 years, 40 years, right, Howie? Telling them you got to walk, you got to exercise. What a great success we have had. So just telling people to go to the gym, get a treadmill desk, it just isn't going to do it. You have to figure out how to make the healthy thing the easy option. And over and over, and this will be a big theme as we go through the day. By the way, the National Center for Environmental Health was located on Buford Highway in Atlanta, and every week I would drive down to headquarters on Buford Highway, a 7-lane highway, 3 high-speed lanes in one direction, theoretically going 45, but really going 60 and 70. A suicide lane in the middle where people trying to turn, and then the high-speed lanes going the other way. And we would, so it's surrounded by the homes of the poor. And one day in 1999, I'm going to work. It's 98 degrees outside, 95% humidity. I'm late. I'm looking down, worried about what I've got to talk about. And I look over to the right side of the road. And here is this elderly woman. And she's bent down with osteoporosis. And she's got a couple plastic shopping bags in each hand. And she has red hair. And she looks like my mother. And I want to stop. And I want to give her a ride. And I, of course, don't do it. I'm late to go to the director's meeting, and men don't offer women rides. And so I go to my, and we're talking this big stuff. And I'm thinking, that poor woman. If she collapses and dies in that heat, the cause of death will be heat stroke. Discharge. And if she's killed by a truck going by, the cause of death will be motor vehicle trauma. And it won't be lack of sidewalks, lack of public transportation, poor urban planning. And I went back to my office and I called this man right here. I called Howie and I said, Howie, we've been worried about stuff remote from people's lives, toxic chemicals and things that are very important, but there's nothing more palpable than where mom lives, where your kids live in terms of life quality. And maybe we should be focusing just like our great-grandparents did on where people live. We thought that we're going to fix all of our problems by getting into cars and driving out to the suburbs, and if the cars are air-conditioned with a good sound system, boy, life is perfect, right? Well, I was lucky enough to have hired, I didn't really do it, Chris Kotitsky, and Chris is here from CDC, and Chris is a certified planner, the first planner we ever hired, urban planner, at CDC. And I said, can you teach me about this? And he sat and he taught me for several hours. We met a number of times. And the point of this slide, and then when I teach, I say, look at this building we build about 3 million of those buildings up there. And I say, what's the message of that particular building? What's the most important thing in their lives? Yeah, we've wrapped humanity around the car, around the garage. And so we've made human experience secondary to the needs of the automobile. And then we build neighborhoods that isolate people as well. I was very concerned about air quality. And decline in air quality, one of them is that we've removed 60,000 square miles of vegetation and photosynthesis. Right there, the deforestation has increased climate CO2 accumulation in the atmosphere about 14%, right there alone. And then you put a hot surface that bakes in the sun, you're already amplifying it and degrading air quality from there. Not to mention what's coming out of the cars and exhaust and all the rest. And this is actually Los Angeles. You've probably been on this.
That's amazing.
6 to 7%. 6 to 7% of all the CO2 produced on the planet is coming from concrete. Basically cooking limestone and then pouring it and the curing of concrete. It's enormous how much we're putting out. So I said to Howie, I think let's change the thrust of environmental health. And Howie was great fun. He said, oh, okay, Dick, I have a sabbatical. And the nice thing about being director is I had a slush fund, so we paid for Howie's sabbatical, and he came over and he had a series of magnificent ideas. The first idea was, let's see the extent of the database on how much people know about health in the built environment. And here's 2002 and 3, no presentations whatsoever on this subject at the immense American Public Health Association meeting. I have a later slide that shows there were only 53 articles in the searchable online Medline literature that related to these two issues. So we're going to have to make this up ourselves. And with Howie's leadership, we called up the Carters down in Florida and we said, we want to learn about community policing through environmental design. To make a long story short, if you change the environment and the sight lines, you reduce crime if you have eyes on the street. We want to hear about water and how much water, I didn't know this. You think I had been all these years. I didn't know that God wants water to go into the earth. And if it doesn't go into the ground, that's a bad thing. And so we had experts on hydrology come in. We had, of course, air pollution experts, and I think Rob McConnell is going to be here as well. And over again, each set of experts, one of my favorites is Bill Sullivan came in and said, in the 50s and 60s, we built schools without windows because it was thought that children would not learn well if they were able to look out the window. I'm not making this up. And so removing children's contact with nature. He and his wife were the ones that did the studies, look in Cabrini Green and Robert Taylor homes about contact with nature was really important to behavior. So this man accumulates, I'm a little jumping ahead, so we began to talk about this, and Chris says, let's write an article for Sprawl Watch. So we came out, and I was quoted as saying, how we've built America is killing people. And so it comes out in the news, CDC says, we're killing people with how we've built America. And within a week, the National Association of Home Builders sends a note to the head of, no, they issued a press release that said this is so trashy, it isn't, you couldn't dignify it by calling it junk science. And they issued another note that said, well, CDC data shows that people who live in the suburbs live longer than people that live in cities. No controls over how much people earned. Yeah, suburbs are good for you because they live longer, not to mention that you were richer. So, but it got worse because I got hauled into the director's office, and this is true. And they said, Dick, a couple dozen members of Congress want you fired because of what you said. And where's your data? Well, yeah, how many data? It's just common sense, you know. You know, if you destroy the environment, you don't let people walk, you make them lonely, isolated, overweight, it's bad for them. Dick, you need to be quiet until you have the data. And that's actually part of the purpose here. And at the same time, Larry had already begun these surveys, but they were expensive because accelerometers were expensive. It was very challenging, and he will talk more about the work that he did measuring people's physical activity during that time. I was not fired, but boy, oh boy, I realized I needed to do data. So Andy Dannenberg and Howie and I and a number of others, we pulled together this full issue of the American Journal of Public Health, and it was September 2003 where we created probably as many articles on built environment as health as existed in the Medline literature at that time. Howie, and he needs, all right, who's the youngest person here who can read? Birth date. What year? 88? Anybody younger? 95? 85? My hearing's not so good. All right. So I'm going to present to the youngest person here the finest book ever written, in my humble opinion. The lead author is Dr. Howard Frumkin, and it's Urban Sprawl and Public Health. And I promise that Howie and Larry and I will sign this book. And tell us your name. What is your name? 95. Oh, I thought you said. All right. Tell me your name. All right, Christine, you get the book at the end. But there'll be a quiz later. It was really important for us to reach out to the medical establishment, and this doesn't happen in a week. You have to get through many committees, and they go, you're a bunch of communists. You know. And we had to sort of convince them with data why we need to build communities that make it easier for children to live, to make it easier for elderly people to live. And here's their policy statement, and I won't go through it, but basically says this is the way we need to build for children. We had to reach out to major cities, and New York City, you hear about the great stuff they were doing. A lot of that was driven by the health data that came out of CDC and Larry and other researchers to create both buildings. The first time I ever heard was from our obesity people, from Larry, but Bill Dietz, about the fact that if you walk up one flight of stairs a day, every day for a year, it's the equivalent energy burn of a pound of body fat. And so we began to, I gave a talk to the American Institute of Architects on why they need to reimagine how you build all the buildings in America so they have pleasant and attractive stairways, which was unheard of at UCLA 10 years ago, I will tell you. And it's gotten much, much, much better. Urban Land Institute, biggest developers in the country, beginning to embrace health as an issue. And the president of the Urban Land Institute said to me, 20 years ago, we used to build for around golf courses. And now we realize, and this guy was exactly my age, and he had exactly the same number of grandchildren, and he said to me, I don't want to build for golfers, I want to build for my grandkids. And we began to, if you will, collude on how to make this happen, so we're going to build a healthier America. they put together 10 principles that the builders and developers would use, and two of my favorites are make healthy choices easy and make it active. And what's fun is, you know, some of these people may have been the folks saying fire this guy, and now it's sort of their DNA. This is the toolkit that they did. The Institute of Medicine, all the docs came out with a statement that said, this is how we're going to stop the obesity epidemic. They had 20 recommendations, and recommendation number 1 was the planners, transportation officials, and the people in this room. You've got to build communities to make physical activity a priority by increasing access to such places. It's now common sense, thanks to Chris, but many other people, the Surgeon Generals, put out the step up for walking. Things got better. By 2011, land use had 102 sessions at the APH meeting and 182 on built environment. Look at last year, I didn't do 2017, 1,000 matches on land use and 703. So nobody can say you don't have the data. And Larry will document that even further, I'm sure. This was a big battle because we were dealing with the Prevention Services Task Force. You don't know this, but for example, they're the ones that make recommendations on doing PSAs, doing breast, you know, that's the clinical one, but there's also one for public policy changes. So having the Prevention Services Task Force say, yeah, this really does work. And Jonathan Fielding was on this task force, who we've named our school after. So just 5 years ago, Howie and I are working on another article on this. We're up to 665 articles, but we've failed. And that really is my lead into the next speakers as the present and future. Look at 2016, if you remember the colors before, they were all yellow and green. And here's diabetes, also desperately frightening. In Louisiana now, about 1 person in 7, I think, adults has either diabetes or pre-diabetes in a number of those states. This is kind of abstract, but getting the transportation engineers, getting Caltrans to incorporate these issues into their fundamental DNA, their mission statements, how they fund programs, and Teresa's, you've worked with Caltrans, and they've become a much better partner than they were in the past, Tina. So with this, I'm going to stop, and thank you very much. I have 2 other gifts. Actually, who's the oldest one in the room? All right. Oh, no, Angelo, I'll give you one on your own. All right, come up to me, and we'll do all right, Neutra, you wrote the book. We'll get you there, and this is the companion book for my PBS series, and I'll actually give you the discs for the PBS series as well. So thank you all for coming. You are doing such important work.
Stand up if you can stand. There you go.